Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Lovenox. Introduction. Lovenox, or enoxaparin, is a medication that helps prevent blood clots from forming or getting larger in the blood vessels. Your healthcare provider may recommend Lovenox for you. Lovenox is injected through shots in the fat layer under the skin. You may be asked to give yourself injections of Lovenox to prevent harmful blood clots from forming. This program explains how to use Lovenox safely. It also discusses signs you should look for when you are being treated with Lovenox. Blood clots. When a person gets injured, the wound bleeds. Blood has substances that help it to clot, causing the bleeding to stop. This clotting happens after skin injuries as well as after injuries inside the body. Sometimes the body forms clots inside the blood vessels. If a clot moves to a narrower blood vessel, it will block the flow of blood. The part of the body that is fed by the blocked blood vessel could die if blood flow is not restored. Blood clots can be harmful. They can cause a heart attack if they block a blood vessel in the heart, a stroke if they block a vessel in the brain, or difficulty breathing if they move to the lungs. Blood clots are more likely to form if a person is lying down in bed after surgery. They can also form after a stroke, heart attack, angina, or other medical conditions. Patients with some types of cancers are at an increased risk of developing blood clots. Smokers and women on birth control pills are also at an increased risk of developing blood clots in their blood vessels. To prevent blood clots from happening, healthcare providers may prescribe medications that thin the blood. The blood of patients on such medications takes longer to clot. These medications are called blood thinner medications. Lovenox is one type of such blood thinning medications. It is also called enoxaparin. Lovenox. Lovenox is given through an injection in the skin. The medication is administered in the fat layer under the skin. This is called subcutaneous injection. Subcutaneous means under the skin. Your healthcare provider will tell you how much Lovenox you should inject. This is called dosage. Follow the dosage prescribed by your healthcare provider. Do not miss a dose. If you do miss a dose, inject it as soon as you remember it. But if it is almost time for the next dose, skip the missed dose and continue your regular dosing schedule. Tell your healthcare provider if you are allergic to heparin. Heparin is a substance similar to the medication found in Lovenox. Tell your healthcare provider what prescription and non-prescription medications you are taking, including herbal supplements. Tell your healthcare provider if you take aspirin or other medications containing aspirin. Tell your healthcare provider if you have or ever have had kidney disease, an ulcer, infection in your heart, stroke, or a bleeding disorder. Tell your healthcare provider if you are pregnant, plan to become pregnant, or are breastfeeding. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. The syringe. Lovenox comes pre-filled in syringes that have the exact amount prescribed for you. When you receive your Lovenox syringes, check the medication name and dosage. You should also check the expiration date. Do not use the syringe if it is expired. Look at the syringe before using it for cracks or leaks. Check that the color is clear. Do not use the syringe if the Lovenox solution is discolored or if it contains particles. Store pre-filled Lovenox syringes at room temperature, which is between 59 degrees and 77 degrees Fahrenheit. To store your syringes, you may wish to keep the original container in a clear store bag or plastic container so they do not get wet, lost, or damaged. Keep out of the reach of children and pets. Injection procedures. Your healthcare provider will teach you how to give yourself the shot. This section reviews how to inject yourself with Lovenox in the stomach area. Select a room to give yourself the shot. Pick a clean, uncluttered room with good lighting. Get the Lovenox syringe, an alcohol prep pad, a cotton ball, and a biohazardous waste sharps container to put the syringe in. You must use a different side of the stomach each time you give the shot. This is called rotating the sites. Wash your hands. Hand washing is the most basic thing you can do to prevent an infection. Wash your hands before and after the injection. Sit or lie in a comfortable position so you can easily see the area where you will be injecting the medication. If you had total hip replacement surgery, administer Lovenox lying down. Select an area on the right or left side of your abdomen, away from your belly button and out towards the sides of your hips. This is known as the love handles. Clean the area you have selected for your injection with the alcohol prep pad. Allow the area to dry. While the area is drying, carefully remove the needle cap by pulling it straight off the Lovenox syringe. Discard the cap in the sharps container. To keep the needle sterile once you've removed the cap, do not set it down or let the needle touch anything. Do not push out the air bubble from the syringe. Hold the syringe so the needle is pointing down. Do not touch the needle. Gently tap the side of the syringe so the air bubble goes up against the plunger. Now hold the syringe in the hand that you write with. With your other hand, gently pinch an inch of the cleaned area of your abdomen. Use your thumb and forefinger to make a fold in the skin. Be sure to hold the skin fold throughout the injection. Quickly insert the needle like a dart into the skin fold as far as it will go at a 90-degree angle. Slowly push down on the plunger with your finger until all the medication is given. If you push too hard at the end, you may activate the safety shield. Be careful to push slowly and gently. This will deliver the medication into the fatty tissue of the abdomen. Be sure to hold the skin fold throughout the injection. Remove the needle quickly by pulling it straight out and release the skin fold. Point the needle down and away from yourself and others. Push down on the plunger firmly until you hear it click to activate the safety shield. You can use a cotton ball to gently wipe the area. To avoid bruising, do not rub the area after completing the injection. Place the syringe in a biohazardous waste sharps container. Your town or state may have laws about disposing of these objects. Check with a member of your healthcare team for specific instructions. If asked by your healthcare provider to keep a log, record the date, time, and site of your injection. Precautions. Lovenox will make your blood clot slowly. This means longer bleeding if you injure yourself. Be careful as you walk and avoid bumps and falls. If you use knives when preparing food, be extra careful. Razors and hard toothbrushes can cause bleeding. Use an electric shaver and a soft toothbrush instead. Tell all your healthcare providers that you are taking Lovenox. If you have epidural anesthesia, spinal anesthesia, or a spinal puncture while taking Lovenox, you are at risk of blood collecting in the spinal column, which could cause paralysis. Do not take aspirin or any products containing aspirin while on Lovenox. If you are taking low-dose aspirin, discuss with your healthcare provider if you should continue to take it while receiving Lovenox. Tell your healthcare provider about any medicine, prescription, and non-prescription that you are taking. Do not miss any scheduled medical appointment or laboratory test you have. When to call. Some side effects of Lovenox are normal, and others are serious and need medical attention. Normal side effects include minor bruises or small amounts of blood at the injection site. Serious side effects are rare but can still happen. Severe bleeding should be reported to your healthcare provider immediately. Signs of bleeding include spontaneous bruising, black or bloody stools, blood in the urine, cough or vomit, nosebleeds, and swollen ankles or feet. Allergic reaction should be reported. Signs of allergic reaction include rash, hives, and itching. Infections should be reported immediately. Signs of infection at the injection site include fever or chills, irritation or burning at the site of injection, redness or swelling at the injection site, pain, skin is warm to the touch, drainage. Report a serious fall or hitting your head to your healthcare provider. You will need to be monitored for internal bleeding if you have such accidents. Report any other abnormal signs you experience, such as chest pain, shortness of breath, or irregular heartbeat. If you think that this is an emergency, go to the nearest healthcare facility or call 911. If you become pregnant while taking Lovenox, call your healthcare provider. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Lovenox, or enoxaparin, is a medication that helps prevent blood clots from forming or getting larger in the blood vessels. Blood clots can be harmful. They can cause a heart attack if they block a blood vessel in the heart, a stroke if they block a vessel in the brain, or difficulty breathing if they move to the lungs. Lovenox is given through an injection in the skin. The medication is administered in the fat layer under the skin. This is called subcutaneous injection. Subcutaneous means under the skin. Your healthcare provider will tell you how much Lovenox you should inject. This is called dosage. Follow the dosage prescribed by your healthcare provider. Do not miss a dose. If you do miss a dose, inject it as soon as you remember it. But if it is almost time for the next dose, skip the missed dose and continue your regular dosing schedule. Lovenox comes pre-filled in syringes that have the exact amount prescribed for you. Some side effects of Lovenox are normal and others are serious and need medical attention. Normal side effects include minor bruises or small amounts of blood at the injection site. Serious side effects are rare but can still happen. Thank you for using Explain.